Welcome to the pre-briefing video for the 2025 IPE Acute Care Simulation in the College of Health Sciences Experiential Learning and Simulation Center. The objectives of today's simulation are to work with individuals from other professions exploring various roles in the healthcare system to deliver the best care possible to your patients. Number 2 is to collaborate with the healthcare team within a climate of mutual respect and shared values. Number 3 is to communicate effectively with other team members of the healthcare team, family members, and patients regarding the plans of care. And number 4 is to reflect on individual and team performance to improve future patient outcomes. In this video, we'll be reviewing several important rules, guidelines, and tips for your success. To begin with, we'll go over some important things that will affect your care today. This is to be treated as a real hospital shift, so all policies that are in practice apply here. You are to remain in your role until after debriefing. There will be universal respect for all people. Be respectful of those around you, your peers, faculty, staff, and standardized patients, as well as those who may be visiting or observing. Each of your programs has a faculty that is serving as a resource for you. Make sure you know who your resource is and how to get in touch with them before the start of the simulation. HIPAA applies to this simulation as it does all simulations. This is especially important regarding your friends on other shifts. Please do not talk to them about your experience. Let them experience the same simulation as you do. This is an interprofessional simulation. Be a team and utilize your resources. During the simulation, you will be working with an interprofessional team. That team will consist of students from physician assistant, undergraduate nursing, physical therapy, and pharmacy. You will be assigned one of 4 units. We have 2 med-surg units, and those will be in 1358 and 64. Your patients on those units will be standardized patients. ICU will be in the high fidelity area. Your patients will be standardized patients and mannequins. And then the emergency room will take place in exam rooms 7 through 10 and 1334, and your patients will be standardized patients. Each unit will be assigned a team with members from all 4 programs except for the ER. There will not be a physical therapy student or pharmacy student on your team. There will, however, be an on-call number listed in the ER if you need these members of the healthcare team to come to the ER to see a patient or to answer a question for you in the care of your patient. While your specific role is very important, the goal is to function as a team. You will be given your priority orders to see patients when you receive report. While we realize this may not be exactly how you would do it in practice, it is intentional so that everyone can see the patients during the simulation. Please allow all members to take care of the patients and do not dominate the care and time. Your experience will take approximately 2 hours and 45 minutes to complete. You will report to your pre-briefing room for a 30-minute pre-briefing and team building exercise. This will get you introduced to the members of your team and ready to take care of your patients. You will then receive report and proceed to simulation for 1 hour. During this time, you will see multiple patients, follow orders, do assessments, do interventions, and take care of your patients. You will then have a time of bedside rounds. This will take about 30 minutes, and each person will go and participate during this, and we will go over that in just a little while. Then your team will proceed to your debriefing for about 45 minutes. You will pre-brief and debrief by unit, and the rooms are listed here for what unit you're assigned. Once you are in simulation, you will have an area that you're assigned to, and your supplies and equipment will be in those areas. Each unit will have a supply area and a medication area. We will discuss medication separately. There will be some extra linens. Patients may have some supplies at their bedside if you cannot find them. If looking in both of those places and you still can't find something that you think you may need, ask one of the resource personnel in the room. For this simulation, we will be using paper charts and results. These will be found in the blue chart with the patient's name on the front. Sign off the orders as they are done. Please only use pencils, as we want to make sure that everyone stays clean and safe. Do not write on any lab or diagnostic results. You will also see an extra chart, which is the green chart you see here. This is for reference only, so that if someone needs to look at a chart while someone else has the blue chart, you can get the green chart and see what's existing. This will not have new results or new orders put into it. You will not write in this, take off, or add anything to it. It is simply for reference of where the patient starts at the beginning of simulation. As you receive new orders and results, you will place them in the blue chart under the correct tab. As you see in the blue chart, you will have tabs for each area of care where your forms will go. This will be found as well as where your results are to begin the shift. Your green chart has fewer tabs, but should have the information that you need to begin the shift. In your chart, you will have orders, order sets, a medication administration record, progress notes, and your vital signs graphic sheet. Please utilize these correctly as you chart on your patient. Some important notes about the chart. Your existing test results are under diagnostic. Your lab results are under laboratory. Vital signs, height, and weight are under the graphic tab. This will be where your vital signs form is found to chart your vital signs on. Newly ordered lab results or test results will be in paper format and at the information desk for each care area. You must have an order to receive the test results. The information desk will also have various forms for your use if you need specifics for your patient, such as consents, checklist, any form that you would need, check there first. You may also check in the Navy folder with your patient's name on the front. Be sure to place all paper forms on the patient's chart under the correct tab. Each chart will have a progress note in it. These are to be used by all members of the team. Please write continuously on one sheet of paper if at all possible. This will help keep the team on track and know who has done what. You can use this for intervention notes, care notes, soap notes, anything that you need can go on these pages. Please date and time and sign your name so that everyone knows what each member has done. So if your patient has existing orders or orders that have already been completed, those will be on the chart. Please make note and follow the orders that you have. If new orders are needed, use the order set you see to the left. These will be located in your patient's Navy folder. You may not order tests, labs, or meds that are not listed on this order set or on the formulary that's in the Navy folder. There are a few blanks to write in orders if you cannot find what you need listed. However, it is not guaranteed that these orders will be able to be carried out. For new orders for labs and diagnostic tests, you will take the order to the information desk and ask the unit secretary for the result. You'll give the patient's name and the test result or results that you need. You will then take that result back to the chart and place it behind the tab that it should go in, the blue chart. On the footer area of the results is the number of result in order so that you will have an idea of which lab happened in which sequence. So medication administration has a lot of guidelines, so please be very mindful of these. Each unit or each area will have a pharmacy area. Your medications will be either in a basket, labeled, or on the counter, or in the cabinet that you see on the right. You must have an order to go and pull the med. Your meds will be labeled, so pay attention to dosing and take only what you need. Once you have given a medication, be sure and chart that on the medication administration record so the rest of the team knows what has been given. Your pharmacy can be utilized as a resource for medication questions. You have pharmacy team members available, so please utilize them. Be sure and dispose of sharps in a sharp box. Syringes without needles on them can be left at the bedside to be reused on another simulation. Be sure and follow the rights of medication administration. Just because it's a simulation doesn't mean that you don't follow these. All patients will have armbands, dates of birth, and medication administration records. Please be sure to correctly administer all of your medications. So some special simulation circumstances regarding medication administration. Your patients will have ports that are exposed to be for IV meds. If you do not have a pump, you will use the simulated pump setup. We will go over that at the next slide. You will use your basic primary IV tubing for these. You do not need to use pump tubing. The SPs will have a drain bag that their IVs are connected to, and this will be labeled. Please disregard this, but if you see that it's getting full, empty and then reapply. Your injections are to be given in an injection pad. These can be found in the supply area of your unit. Take the injection pad to the patient and place it on the area that the injection would be given. With your gloves, your alcohol, clean the area, give the injection in the pad, and then return the pad to the supply area. Once you have given your medications, be sure and chart them in your medication administration in real time of when they were given. Because we do not have enough pumps for the number of patients we are taking care of, some areas will utilize this simulated pump setup. This is printed on cardstock, and you are to treat it as a 2-channel Alaris pump. You will hang your IV fluid with regular primary tubing and hook it to the patient. You will then fill out the Alaris pump settings card and clip it to the cardstock as you see on the left. You will put your time, the medication you're hanging, and the rate at which it should go, as well as the volume. This lets your faculty know that you've hung the medicine and at the correct rate. You do not have to let the medicine infuse, or you can adjust it with the roll clamp and have it go in as a slow drip. So there are some special instances that you need to remember when taking care of your patients. The RN is responsible for making sure orders are completed. Sign off your orders as you do them. Everything needs to be charted. Vital signs, assessments, SOAP notes, anything that you need to get done should be in the chart. If you need to obtain information from an assessment, such as vital signs or listening to breath sounds, once you have completed that task, the SP will either give you the information verbally or on a card, but you must do the appropriate action prior to getting the result. There will be no Foley's, NG tubes, or IV insertions. Patients have what they need already on them. Please do not order or try and complete this task. If you do something with the patient, it must be charted. This is the only way that your team knows what has been done. Utilize your progress notes, your MARs, your vital sheets, your order sheets, anything you have to make sure that you document. If you are to need any blood products, these will be at the information desk, just as you would get a lab result. You may see some of your patients with white long socks on. These will be used in place of TED hose or your compression hose if your patient has those ordered. Each unit has a policy binder, so if there is something that you're not sure of, then you can go to the policy and procedure binder and see if there is a listed policy for that. If you cannot find a policy or procedure on the item you have question about, that would be a great time to utilize your faculty resource. If you're ambulating your patient, you may ambulate them away from their bed. We encourage you to utilize the hallway rather than other patients' spaces, since there will be patients close together, especially on the medical, surgical, and ER units. After the 1-hour simulation, the team will participate in bedside rounds. Every team member will participate in this, and it will be done at the bedside for each patient, except for the ER, who will return to their debriefing room and discuss rounds at that time. The PA will lead the discussion as the provider, but each department and program will discuss current patient status and plan regarding their role in the care of that patient for the next 24 hours. This is a great time to discuss questions or care concerns regarding your patient. So now you're ready to go be great. Be positive, be flexible, utilize your resources, think about your role and responsibilities, learn a lot, remember to breathe, and most importantly, remember this is a learning experience. We hope that you walk away from today being a little bit more comfortable with being a team member in the healthcare setting.